I'm Professor Azizur Rahman, and today's video is not about a medical topic, it's not a lecture, it is about World Hypertension Day. And you all know that 17th of May is internationally celebrated as World Hypertension Day. And this was initiated by World Hypertension League, which is actually an umbrella body of many international leagues dealing with hypertension, and Pakistan Hypertension League is one of them. The purpose of this day is to make people aware of this condition, which may be absolutely asymptomatic and could prove very serious if not diagnosed and if not treated. I think we know that there are certain risk factors. If you have a family history of high blood pressure, if you yourself had high reading in the past, if you're overweight, if you have diabetes, and even otherwise, I think you must have your blood pressure checked. We recommend that as a patient, if you go to a doctor, and I think it is your right to ask the doctor to check the blood pressure. And similarly, my message to our colleagues is that whatever purpose patient comes for, you must check the blood pressure, because only then you can diagnose this condition early enough before it causes any complication. Now, unlike many diseases, hypertension is very easy to diagnose. All you have to do is to make a very careful and accurate measurement of blood pressure. Now, what is that method? Patient should be seated on a comfortable chair for at least 5 minutes, and patient should have emptied his or her bladder before the blood pressure measurement, should have not eaten or taken any stimulant recently, should be physically and mentally as relaxed as possible, and then with a calibrated blood pressure apparatus, which may be mercury, which may be aneroid, or which may be digital, you make an accurate measurement of blood pressure. And if the readings are even slightly high, then you need to repeat them on the other arm, and maybe after a few minutes repeat the reading. So in a normal healthy person, reading should always be less than 140 by 90. 140 by 90 is considered to be the cut point, but slightly less than 140 by 90 is also something to worry about. Ideally, blood pressure should be 120 by 80 or around this figure. So if your readings are high, you could maybe start treatment immediately, or if it is borderline high, least you should do is to have it measured again after some time. So many patients are in denial phase. They would try to convince you that their reading is high because they ate something today. So I think you need to explain to them that it would be best if we identify this silent killer and start treatment. Treatment is not necessarily with medication. The first step is, of course, lifestyle changes. Now we will ask our patient to reduce their salt intake, and we would also ask them to do some physical activity, and also try to remove some other factors, medicines, which may be contributing to hypertension. Non-steroidal anti-inflammatory drugs or steroids or some other drugs may be actually contributing to high blood pressure. Now, sometimes these drugs may be essential for that patient, but we will go through the prescription and see if we can remove any of those medication. So if readings are high, we start with the lifestyle changes, and if reading is very high, then we know that lifestyle changes alone are not going to be effective. Then trying lifestyle changes alone would be like wasting time. So if somebody has comorbidities, somebody has like heart problem or diabetes, I think I would start medication on just one reading which is significantly above normal. Unless I can tell for sure that this patient is going through some acute stress. So if readings are high, then we start medication. We have number of blood pressure medication. We have old-fashioned diuretics, hydrochlorothiazide. We have angiotensin converting enzyme inhibitors. We have angiotensin receptor blockers. We have beta blockers. We have calcium channel blocking agents, and we have mineralocorticoid receptor blockers. It's a number of drugs which are typically used in combination. Now, European Society of Hypertension has recommended that for most patients, our starting medication should be a combination of either ACE inhibitor or ARB on one side with calcium channel blocking agents or a diuretic on the other side. So I think this discussion is beyond the scope of this intro video. So we have to have a high index of suspicion in all patients. I think whoever is in your circle, your brother, your sister, your parents, your friends, your servants, whoever is in your circle, I think from this day's perspective, you should have their blood pressure checked. And if somebody has high blood pressure, that should start working on high blood pressure immediately. Because we know if blood pressure is not treated, it can lead to many complications like stroke, like heart attack, like heart failure, like kidney failure, like dissection of aorta, like pulmonary edema, and premature death. So accelerated atherosclerosis, so many vision problems, so many complications which can result from untreated hypertension, and with the treatment and we can prevent all those complications. And this is proven by science. We know that every increment of blood pressure by 20 by 10, 20 systolic, 10 diastolic, any increment by that would double the cardiovascular risk. And when we bring it down, again the risk is low. Now, once we start treating, I think that's another message I would like to give to my professional colleagues. Once you start treatment, the aim should not be bring it back to 140 by 90. Although this is what JNC 8 says, but we must keep a margin of safety also. I would actually try to bring it to at least mid-normal range, if not the lower normal range. For example, I would like my patient to have their sitting blood pressure after treatment around 120, 130 systolic and 75, 80, 85 diastolic. Because this is more physiological and this provides some cushion also in case their blood pressure rises because of sometimes they omit the dose or sometimes they take extra salt, that will still provide them a safety margin. So that is our aim. Once blood pressure is controlled, and this is very obvious to our professional colleagues, but we have to explain this concept to our patients also. If blood pressure is controlled, we have to keep it controlled. So that means long-term lifestyle changes and long-term medication. And you all know no medicine works forever. So periodically, patient should have a follow-up and make sure that all the medicines patient is taking, they are working, blood pressure is still under control, and medicines are not giving any side effects. In case blood pressure is not controlled, then we make appropriate adjustment, because aim is to keep the blood pressure exactly under control. Now, what should be goal? I told you for general purpose 130 by 85, but if you have a patient who is diabetic, or patient who has ischemic heart disease, or patient who has kidney disease, or patient who has heart failure, we are more careful because their heart is already vulnerable. So I think we will try to lower it further and preferably by using angiotensin converting enzyme inhibitors or ARBs, because science has proven that they are better nephroprotective and cardioprotective. So those agents should be included in that treatment plan. Of course, other drugs, they have their merits. Beta blockers are great when somebody has a lot of sympathetic activity, has got anxiety, has got palpitation, and there is resting tachycardia, and that is where we use beta blockers, usually in a small dose. usually in combination with other medicine. Calcium channel blocking agents are great drugs. Amlodipine, very safe and very cheap drugs, particularly for elderly people, particularly for those who have isolated systolic hypertension and those who have black ethnicity. So all antihypertensive drugs have some values. I think treatment of hypertension, there is very strong and sure statement. Treatment of hypertension is very cost effective. You have to do very little effort, very little medication, mostly just 1 or 2 pills a day, and it can prevent lethal complication, those complications which can incapacitate you, which can devastate you. So I think we must treat hypertension, and this year's slogan is measure your blood pressure accurately, even if you're asymptomatic, treat it effectively, and live long. So I think with that message, I'd like to conclude this video, and thank you for watching this video. Thank you. Professor Azizur Rahman from Medurstand-Understanding Medicine.